You have a child who has a belly button bulge. I'm talking of a child, or let's say an infant who is less than, let's say, a couple of months, 2 months, 3 months, and you find the bulge is increasing in size at the belly button area. So this is something called as an umbilical hernia that is present from birth. Now, umbilicus is normally open before when you are in the womb. It is a connection from the placenta. So your umbilical cord comes connected to the placenta, and nutrition of the baby is from that area. With time, the umbilical defect has to close. Normally this happens naturally, but sometimes the bulge may be a little more prominent. In such cases, what do we do, or what can be done? Traditionally, what many people used to do is they used to place a coin on the tummy of the infant, and then they used to tape it a little. This can be followed. It is a good enough practice, but if it is a very large hernia, putting a coin may not be a very great idea. Normally, if you have a very large hernia, your pediatrician will always recommend you to go meet a pediatric surgeon to notice what can be done. But in case it is a small hernia, give it time. Normally, the baby is able to recover. Let us say the hernia persists for a couple of years after the child is born also, 1 year, 2 years. No symptoms. Again, normally you can wait for some time, but in case the hernia is not reducing and it is increasing in size, surgery may be an option that is required. And in kids, when we do a surgery for an umbilical hernia, it is generally a suture repair. We put some stitches and we repair the hernia, but we do not place a mesh in a child. We wait for the child to grow up. Now, these kids at the age of, let's say a kid is 6 years, 7 years, the hernia is there, not reducing. It is better you undergo a surgery so that you avoid complications. Complications in children deteriorate or worsen very fast. You don't want to get into this sort of a phenomena. So kindly plan for a surgery if your surgeon is recommending. But as a gist of this video, normally a hernia is there in a small kid or infant, you wait it out, but keep your surgeon in the loop or keep your pediatrician in the loop regarding the symptoms that are there. Otherwise, taping with a coin is always going to be useful. Thank you.